Ryne Sandberg died from metastatic prostate cancer. He was just 65 years old. I spent a lot of years in Chicago going to medical school, undergraduate and graduate school at the University of Chicago, and Ryne Sandberg was an institution when I was there. The second baseman who was a Gold Glove, a combination of power with his bat and an amazing ability to play defensive baseball. He was the franchise and the face of the franchise, this humble player that did everything asked of him for all the years he was on the Chicago Cubs. And he died of prostate cancer. He has the same cancer that President Biden has. It is metastatic, it is in his bones, and there's nothing we can do about it. He was first diagnosed with the cancer a couple of years ago and then presented himself and thought he was cancer-free. Unfortunately, a few months later, his cancer came back and he died of it. The difficulty with prostate cancer is we have those forms of prostate cancers that are so aggressive and so undifferentiated, they don't even produce the prostate-specific antigen. So people can't tell that they actually have the disease. That's a little scary. So if you're concerned about it and you're a man at the age of 50, you should start getting your PSA test. 45 if you are black, or 45 if you have a family history of people who have had prostate cancer. And if they do find the elevation, then they're going to do an MRI of your prostate and look at it. We no longer do the digital rectal exam. We now have much better evidence using the MRI. Science wins again. And we do have therapies for some of this. We're just not that effective. But early detection and early treatment is the best defense we have now against prostate cancer, which is, next to skin cancer, the most common cancer found in men in the United States today. So I'm very sad that Ryne Sandberg is gone. He was one of the heroes that I had as a baseball fan in Chicago. But I hope this inspires some of you to get your PSA test. Guys, we're coming into Movember. It's time to line up and get your PSA test. You don't have to do this anymore if it's elevated. We can fix it with just an MRI.